Good afternoon, everyone. You are watching webinar on innovation and advancement in health sciences, brought to you by Faculty of Health Sciences, MAHSA University. My name is Murni Amira, and I'm the moderator for today. Today, we have Dr. Chia from Department of Environmental Health, Mr. Sim from School of Physiotherapy, and also Ms. Nadia from Department of Medical Imaging. All three of them are very experienced persons in their field, and they are here to present on various innovation and advancement in health sciences field. Before we start, I would like to introduce to you guys to our Faculty of Health Sciences, MAHSA University. This faculty consists of three departments, which is School of Physiotherapy, Department of Environmental Health, and Department of Medical Imaging. These three department basically offering various programs that are available for everyone outside of MAHSA University. Example of the program that we are offering is under the School of Physiotherapy, we have Diploma in Physiotherapy, Bachelor of Physiotherapy, Online Distance Learning for Bachelor of Physiotherapy, Master of Physiotherapy, and under the Department of Environmental Health, we have Diploma in Environmental Health, Bachelor of Environmental Health and Safety, ODL program, which is the Online Distance Learning program, also for the Bachelor of Environmental Health and Safety, and also we are introducing the Diploma in Occupational Safety and Health. And lastly, for the Department of Medical Imaging, they are offering the Diploma in Medical Imaging, Bachelor of Medical Imaging, and also the Online Distance Learning program, which is the ODL program for Bachelor of Medical Imaging. For more information, please follow us on Facebook and Instagram, and you may also find us at MAHSA University webpage at mahsa.edu.my. So let's begin with today's webinar entitled The Innovation and Advancement in Health Sciences. The first panel will be Dr. Chia, who will be presented on the innovation and advancement in the environmental health. Dr. Chia, would you like to share your screen and get our session started?
Hello everyone, I'm Dr. Chia, and today I will share with you some information related to biological and physical vector control, as well as the effects of volatile organic carbon, which is VOC effects, and the prevention. Alright, today I'm going to share with you such information. Let us begin with the number of cases of dengue fever. So from this graph, we can see that the amount of cases has been increasing since year 2000 until 2019. And we can see that in the year 2000, there are less than 20,000 cases, whereby now we have more than 120,000 cases. All right, and we can have the other information regarding the cumulative cases, which has increased by 61.4%, whereby the death cases have increased up to 23.8%. Unfortunately, effective medicine vaccine is not yet available, although many attempts are undergoing. Therefore, the dengue vector control is still considered as the most effective way for controlling and also preventing the disease transmission. Let us have a look at some history of the chemical control. The dengue fever, the vector control started with DDT, which is dichlorodiphenyl trichloroethane, which has been applied in 1940s, which is the beginning of era in using the chemicals as vector control. Because of the POP, which is the persistent organic pollutants, there is increased the effects on the public health. So therefore, it has been banned. Then we move on to organochlorine, organophosphate, or even indoor residue spraying, and also the net All right, for all the vector control, including the malaria cases, or the vector-borne disease. So after that, we have larvacidal treatment, adulticidal treatment. We are using organophosphate, paratrol, thermophos. These are the ones that it is in use currently. And later on, for the alternative approach, we are moving towards biological control, which is more into transgenic and para-transgenic approach as alternative. Yeah. So we can have the approach. The first one that I would like to share with you is using Bacillus thuringiensis based intervention, whereby the mosquito Addis aegypti and Ebopitus is highly susceptible to micro Bacillus thuringiensis H14 in Malaysia. This bacteria is aerobic, gram-positive, endospore, and also crystal-forming bacterium that belongs to the Bacilliaceae family, which is found in infecting the mosquito larva. And these bacteria therefore often apply, and it applies together with the adult site and also larvicide in Malaysia as the biological control agent, and it could be also integrated in the chemical formulation. So how does it work? The bacteria were ingested. All right, these bacteria were ingested by my mosquito larva, and the crystal were activated in the naturally in the alkaline environment of the larva midgut. And what happens is there is enzyme that assists in this larva midgut, all right, will be released to break down this bacteria. When breaking down this bacteria, there will be endotoxin being released from the bacteria. So when endotoxin is released, it triggers the killing mechanism. This is how this biological approach works. Yeah, and of course, these trials has been conducted in Klang area, and it shows that the ratio of mixing the bacteria, all right, and the chemical has to be taken into consideration when we applied it in the ULV fogging machine, right? And the second approach we have is predator of Addis mosquito, which is the Toxorynchitis species. So this is the species that found to be present at the natural breeding site of the mosquito Aegypti, Addis aegypti, and also Evopictus. So the predator was ideal as a biological agent, biological control for the dengue vector because of the natural ability of itself to seek for the breeding site of the vector, which is very difficult to trace artificially. All right. So in Subang Jaya, the municipal council has worked on it. They has attempted to release of this predatory Aedes mosquito into the area since 2010, and the result was quite promising as we can have the hotspot area and the dengue cases being reduced after the release of this mosquito Toxorynchitis species. For the genetic modified mosquito is another approach. What is this genetic modified mosquito? These GM males consist of late-acting lethality transgene that could result in elimination of offspring when the males were released in the open field and to mate with the wild type female. So in Malaysia, micro injection of the late-acting lethality transgene was preferred in the investigation of genetic modified Aedes aegypti program. This is still under research. In Petaling Jaya, they are doing the still researching. In Petaling Jaya Institute of Medical Research, UK-based biotech company, the Oxitec, and also the government. So it was released in the forested area in Pahang at the third phase trial and the effectiveness is still under investigation. So one of the limiting factor using this biological approach is the ratio of 10:1 of ratio of the genetic modifier mosquito and the wild type mosquito was needed. It is still unknown with the effectiveness. However, it is known as the most advanced with respect to the implementation. Next, we have another alternative, which is the Wabasha-based intervention. So this Wabasha-based intervention is based on the concept of trans-infecting mosquito with symbiotic bacteria that can compete with the targeted pathogens and manipulate the host biology to reduce their vectorial capacity. So by two ways it works. One is by genetic suppression or limitation of the vector's ability to serve as competent host for parasite development, thus decreasing the elimination in their ability to transmit pathogens. Another way is by genetic suppression of the insect population by reducing the lifespan of the vector. So there are two ways. So in Wabasha is the endosymbiotic bacterium that can be found like 65% of all the insects. So it can also work in two ways. One is known as bidirectional incompatibility. Another one is known as unidirectional infection. So how does it work is, first one is the strategy of mating. Pairs of males and female will be infected with different Wabasha strain, and the eggs of the female may not be able to rescue the Wabasha-induced changes in the sperm of the male. So what happens is, consequently, this incompatibility occurs at the embryo and we will have less or no offspring survive. All right. So for unidirectional infection, it occurs whereby Wabasha-infected male will mate with the uninfected female, and this triggers the cytoplasmic incompatibility. All right, and this approach occurs in the lab whereby the males will be infected by the lab strain Wabasha bacterium using microinjection, and this allows to be released after the infection, and it will mate with the either uninfected female or infected female, and this trigger either unidirectional or bidirectional incompatibility. This is a way as biological approach for vector control, right? And another way I would like to share with you is the physical control, which is using the concept of ultrasound. So ultrasound is actually act as a repellent, all right, whereby the transmission of disease is biological. Hence, the danger of the transmission persists. So higher mosquito density means higher risk of disease transmission. If there is reported outbreak, that means the density of the mosquito is very high and microorganisms persist in the transmission. Therefore, in this physical control, there is still non-conclusive evidence on how effective the ultrasound control is. We can have a lot of apps being created, all right, with different wavelength, all right, act as a repellent, all right, to make sure the mosquito not in this area. However, it is not a killing mechanism. The transmission is still happening at that area. Yeah. So next we could have another part of the presentation include VOC. What is VOC? VOC is actually known as volatile organic carbon. All right. This is the organic chemicals that have high vapor pressure at room temperature, even at room temperature. And many VOC are human-made chemicals that widely used at home, include perfume, lipstick, detergent, pesticide, office equipment, smoking, etc. And VOC are emitted as gas from solid, from liquid that may have short-term or long-term adverse health effects. And the exposure of the airborne VOC is unavoidable. All right. So concentration of VOC, of course, it is much more higher than the outdoor, in indoor than the outdoor. All right. It is also related with the sick building syndrome. Yeah. So what will be the health effects? The health effects include eyes, nose, throat, irritation, respiratory illness, and so on. All right. So we can see what are the components of VOC. We can have acetone from the nail polish remover, furniture, all right, benzene, ethanol, butanol, formaldehyde, all right. So where is the sources? We can have sources from the industry, we can have sources from our household product, and the impacts, just now I mentioned about health impacts, there are also impacts to the environment. For example, it increases the ground level ozone, all right, which is the air pollutants, all right, and it also leads to depletion of upper ozone layer, all right, and because of that, all the issues, climate change, global warming, all right, which has been an alarming issue, all right, is also contributed by this VOC emission, all right. So how do we prevent VOC from emission? All right, we can have ventilation and climate control. For example, we can increase ventilation by using products that increase ventilation when we are using products that emit VOC. So we can have source control, for example, formaldehyde, all right, from the furniture, one of the best known VOC. Identify them, if possible, remove them from the source. If not possible to remove, we can use sealant to all the exposed surface of paneling and even other furnishing. So avoid using pesticide or use pesticide prudently, all right? It could be using biological control. In agriculture practice, we can have adjust and monitor the usage of pesticide. Okay, and also another way is to use household product according to the manufacturing direction and use VOC less material. For example, green coating, the less or zero VOC paint, all right, and even organic fragrance and so on. So this could be the way of getting the effects of VOC in our indoor and outdoor environment. So as conclusion, upkeep sanitation, all right, is the best prevention. Keep our environment clean and contaminant free. As we could see that the number of cases of dengue fever is increasing, all right. So therefore, what are the factors? The factors include, for example, urbanization, for example, population increase, all right. For example, change in weather, all right. Hot weather it is proven that hot weather will cause a high number of cases and it shows greater pupation, all right, than in lower temperature of the mosquito, and increase of temperature result high survival migration of vectors. And what happened most importantly is the poor environmental cleanliness. All right. So in order to prevent the dengue fever, all right, disease transmission of the disease, we have to keep our environment clean and contaminant free. Not only that, environmental management and this sustainability is the fundamental approach, and well-planned integrated control program, good community participation and mobilization is required to combat dengue fever and the effects of VOC. Community empowerment, accountability, capacity building is a way forward for a sustained healthy lifestyle for all. So risk communication as well, risk assessment as well must be in place, apply at all stages and should not be done when there are increase in number of cases. We have lesson learned from COVID-19 episode, right? Finally, it is you and me and all of us together building a better tomorrow, healthy environment, healthy people. That's all from me, from my presentation today. Thank you.
Okay, thank you very much, Dr. Chia, for her great presentation. It gives us a lot of information, especially on the innovation and advancement related to the vector control and also the usage of volatile organic compound. For the audience, please leave your question in the comment box below and we will attend it during the Q&A session. And do not forget to answer the survey form to receive your e-certificate. The survey link will be provided to you in the comment box as well. Next, we will have Mr. Sim from School of Physiotherapy. Mr. Sim, are you ready? You may share your screen and start whenever you are ready.
Okay, thank you very much, Ms. Amira. So just allow me a few seconds to share my screen. Okay, so good afternoon, everyone. I hope you guys are doing well. So today, the topic that I will share with you guys is about Cybernetics, the new medical technology. Okay, so dear viewers, I understand that all of you are eager to know more about the innovation. But first, let us understand what exactly is Cybernetics. Okay, so Cybernetics is actually a new domain of interdisciplinary research and academic field that fuses human and robot into one. It usually centered around humans and also mechatronics, neuroscience, robotics, information technologies, as well as artificial intelligence. So now, knowing what Cybernet is, let us have a look on today's innovation, which is the hybrid assistive link, or also known as HAL. Okay, so meet Dr. Yoshiyuki Sankai. So he is actually the founder of the HAL. Okay, so he actually started in the year 1989, where after receiving his PhD in robotics, he started develop the HAL. So it took him about 3 years to map out the neurons that governs the leg movements, and another 4 years to develop the prototype of the hardware to be applied on the HAL actually. So in 1997, the earliest prototype was being completed. And in the early 2000s, the third HAL prototype was actually developed. But the thing about this prototype is that it weighs about 22 kilograms and it requires 2 helpers to put it on. So it is actually very impractical to be used. So they have tried to think of many other ways to lighten the weight and all, to modify it to make it even better. And it all actually changes after the 5th HAL suit was being released in the year 2012. So this model, it weighs only just 10 kg, okay, 10 kilograms. And the HAL 5 suit has the battery as well as the control computer strapped around the waist of the user. So it actually is very convenient. The user can wear it and move about, and it can be, with one person, the hull can be attached to the user. So and also this version of the hull suit actually received a global safety certificate in the late February of 2013. This makes it the first powered exoskeleton to own a global safety certificate. Okay, so nowadays the hull for medical use has become one of the medical devices in Japan, the United States, the Europe, and it is currently making its way into Asia as well as the Middle East. So, what is hull exactly? Hull is the world's first cyborg type robot that actually improve, support, and enhance the wearer's bodily function. Okay, it can assist a physical challenged person to move about and enable him or her to exert bigger motor energy than usual. Okay, it also helps in accelerates a motor learning of the cerebral nerve, making neuroplasticity even more efficient. So there are many types of hull suits available in the market. So I'm going to share with you guys a few pictures of the one that is commonly seen in both medical and non-medical field. Okay, so the first one that you will usually see is actually the lower limb type, which is it covers from your waist until your ankle. Okay, next it will be a single joint type. This usually will be used in more of a assisting movement only. So you will see it only consists of one joint. Okay, it will only move one joint at a time. The next one would be the lumbar type. This is actually helpful in cases of like heavy labor or even like a healthcare provider where they are required to carry a lot of things. This actually helps cut down the strain towards the back. Okay. Next would be the full body type. This one, as you can see from the photo, it covers all of the body except the head part. Okay, so it covers from the shoulder, the elbow, the wrist, the hip, the knee, the ankle, the lumbar region. This allow a lot of heavy lifting duty to be simplified. Okay, to cut down the load on the user, on the worker. Next, we'll talk about in order for us to understand how the hull functions, we'll look into the system. Okay, so the system that runs the hull is actually called the Cybernet hybrid control system. It consists of three different types of control, which is the Cybernet voluntary control, the Cybernet autonomous control, as well as the Cybernet impedance control. So the Cybernet voluntary control function based on the bioelectrical signal that derives from the wearer's brain and the nervous system that reflects as an intended movement. So meaning it will only provide a physical support or physical action according to the wearer's voluntary intention. Okay, if there's no signal passing around, this control will not be activated. Instead, the Cybernet autonomous control will be used. Okay, so the Cybernet autonomous control function based purely on the processing artificial intelligence, which is the AI inside the system. Okay, so without any signal being sent, the AI will actually being programmed to move for the wearer. Okay, so the wearer don't have to do any, don't have to use any force or any energy. There's no movements in the wearer, but the machine, the artificial intelligence in the machine will help based on the purpose of the motion. Okay, so let's say we set it for walking, so the system will move the limb for the wearer instead of like the voluntary control. You will have to move, you will have to need the signal to pass through. Okay, so the last one would be the cybernetic impedance control. It is a function that adjusts to the various individual characteristics. So this one is more like a more custom-made kind of control. Okay, so in each of the house system, it consists of these three control. So it will select the more suitable one to be applied during that time. Okay, so each wearer will be using different kind of control. So now, what is a house motion principle? Okay, so when the person wanted to move the body, first he will have to think about the movement in the brain. Okay, so per se we are trying to lift up our hand. Before we lift, we will think in our brain, I'm going to lift my hand. So by doing this, the brain is actually transmitting the necessary signals to the muscle. Okay, the required muscle for the movement to happen. And this signal was sent through the nerves. Okay, so as the signal passes from the brain towards the muscle, the heart will actually detect the signal. Okay, the signal that was leaked from the surface of the skin. Okay, this kind of signal is known as the bioelectrical signal. It is a very faint signal. Okay, so the heart actually read this kind of signal based on the detectors that was attached on the wearer's skin. Okay, so once it detects the signal, it will actually move a little earlier than the person's muscles contraction. Okay, so maybe a few milliseconds earlier than the contraction happens. So this will allow the heart to assist the person to move, I mean the person's motion as intended, and even allow the person to give out a bigger power, okay, than what he or she normally exert. Okay, so with this being said, the mechanism to move a human's body doesn't just stop on moving the muscle itself. Okay, the brain will confirm how the muscle move and what kind of signal the muscle, the brain have to emit. Okay, so with the heart assisting the motion, the movements, it provides a feedback to the brain actually. So it is teaching the brain that, oh, these are the signals that you need to emit in order for you to do this kind of motion. So this kind of feedback process actually helps the brain to learn, and it allows the neuroplasticity to work. Okay? So, what are the applications of HAL? So when will you see HAL being used? So HAL can be used in both medical field or even non-medical field. Okay? So let's talk about the medical field. For medical field, usually it will be applied on the disabled person, per se a person with a spinal cord injury or even a stroke patient. It can help in allowing the patient to move and also to learn the motion. Okay. At the same time, it also is applicable on geriatrics. Okay, by means of geriatric here is only applicable for those who are not able to move themselves. Okay, even though they have tried their best, their muscle has gone weak, or there are some other health condition not allowing the patient to move, then HAL will be very useful in this kind of scenario. Okay, as for non-medical field wise, it is seen to be used in the rescue activities, especially in the natural disaster area. And usually in these kind of cases, you will see them putting on a full body type of HAL. Okay, because it helps them to lift up, the stones, the rock, or whatsoever, the pillars, and it allows them to rescue even faster. Okay, and another non-medical field that you will usually see helping use is like in all those heavy labor work. Okay, so per se like a lot of carrying, shifting of the machines or what, you will see them apply HAL, which will actually help in reducing the work-related musculoskeletal conditions. Okay, so as a conclusion, okay, the HAL system is actually a very brilliant innovation that has been proven to be applicable on various fields. Okay, like the example I've given just now in health services, okay, be it towards a patient or even the healthcare providers, okay, or even in industries, it is applicable and it has won a few awards that makes it the best, the very brilliant innovation. Okay, so that's all for my slide today. Okay, these are the references. Thank you very much.
Okay, thank you so much, Mr. Sim, for the very informative presentation. It gives us a very good insight in the innovation and advancement in the physiotherapy field as well. Basically, for Cybernet, it might be something uncommon to a lot of us, and actually is a good topic to discuss and to know as well. Thank you, Mr. Sim. For the audience, please leave your question in the comment box below and do not forget to answer the survey form. You may see the link to the survey form inside the comment box. Now, I would like to welcome Ms. Nadia from Department of Medical Imaging to present on the innovation and advancement in the field of medical imaging. Ms. Nadia, you can share your
Okay.
screen and start whenever you're ready.
All right. Thank you, Miss Amira, for the introduction. So let's wait for a few seconds. I'm Nadia from Department of Medical Imaging. So I'm a lecturer here. Can you all see? Okay, right. So today I'm going to share a little bit about the breast tomosynthesis. Okay. What is breast tomosynthesis? That is the part that we are going to discuss a little bit later. So let's go back to the conventional 2D mammography first. So what? Sorry. Okay. So the mammography is actually a routine radiographic examination that is used for breast cancer detection. So why? What about breast cancer? Breast cancer is actually the most common cancer that affects the Malaysian woman, according to the Global Cancer Observatory 2020. So it says that in 19 women, there will be one woman that is at risk of getting breast cancer. So based on Breast Cancer Foundation survey, they say that the breast cancer is actually affecting mostly the Chinese women, followed by the Indian women, and after that Malays. Okay, all right. So this is how the mammography is done. So this is the radiographer. The patient will actually stand here, and we'll take images of the breast. So the patient will stand here and a little bit, some procedure will be done and images will be taken afterwards. So the 2D mammography, the conventional 2D mammography. So what do we do with in this 2D mammography? 2D mammography actually we take two images of each breast. So one breast, two image. One image is called cranial caudal image, and another image is called mediolateral oblique image. So the mediolateral oblique is the side image, and the cranial caudal image is image taken like this. So what happened during the procedure is the patient's breast will be placed onto the imaging plate, and after that there will be a clear plastic plate that will be pressed onto the patient breast. So during the compression, we'll take images of the breast. Okay, so these are the images of the 2D mammography. So as what I have explained just now, one breast will take two images. So this is a cranial caudal image, and this is a mediolateral oblique image. So one for each breast, so we have 4 images of the breast. So, all right. So how does the 2D and 3D mammography similar? It is similar because we use both are using low dose X-rays, and we still take images, but at the end of the day, both of the radiographic examination emit about the same amount of radiation. Okay, so this is the imaging plate or the image receptor. So this is the clear plastic compression plate. So we'll put the patient breast here and compress and take images. Just take a few seconds, don't worry. Okay, so breast thermosynthesis, also called as 3D mammography. That's why you see breast thermosynthesis here and at the title page, and here is it 3D mammography. Just want to tell you that it is a same thing. Okay, let's do a few comparison about 2D and 3D mammogram. So 2D mammogram, we take 2 images of each breast. So only 4 images for both breasts. And what happened with these images, because only 2 images for one breast, we'll have an image of overlapping breast tissue. Okay, let's say we do a 3D mammogram. 3D mammogram means we take many images of each breast. So one breast, we have a lot of images. So what happens is the radiologist will get more images, so it helps them to detect any pathological condition in the patient's breast. So after a series of images is taken during the 3D mammogram, what happens is the computer will do the transformation. It's a mathematical program that's called Fourier transformation. They'll convert the images to do the reconstruction of 3D mammogram. Okay, let's see this rose petal. So we have a cross-sectional of rose petal. So into the mammogram, it looks like this, where the petals are actually overlapping. So we can see the superimposition of the petals if we compare to the 3D mammogram image. So we can see a finer detail of the rose petal if we compare to the 2D mammogram image. So this is what we call superimposition of the breast tissue, same like the rose petal. So what are the limitations of 2D mammography? Why? Why do one 3D mammogram? Okay, because the first limitation of the 2D mammogram is false negative mammogram. So what happened with false negative? False negative means the breast looks normal. The patient get the diagnosis that the breast has nothing. It's absolutely normal, but actually the patient is having breast cancer. So overall, the screening mammogram actually do not find about 1 in 5 breast cancer. That means it's about 20%, which is quite high. Okay, so for the women who has dense breast, they are more likely to get this false negative mammogram. So based on the study that is done in 2016, 44.7% of Malaysian population are having dense breast. So this is almost half of the Malaysian populations are having dense breast. So if we are doing the 2D mammography, the chances or the risk of misdiagnosis of the breast cancer pathology is quite high. So what happened to these women who get false negative mammogram is they might have sense of security, they are happy because they don't have breast cancer based on the diagnosis. But after that, after a few while, when the cancer has developed, they might go for one more mammography, then the cancer has already spread. Okay, all right. Another limitation of 2D mammogram is actually false positive. False positive means the patient gets abnormal diagnosis, but actually there's no cancer in the patient. So what happens is we might call back the patient. So after the 2D mammography, there is something abnormal with the breast. So we call back the patient to do further investigation, more radiographic examination, might do MRI, might do ultrasound, might even do the biopsy. So all of these incur costs. And another thing is it gives the patient more stress and anxiety. Okay. Okay, so what is the principle of 3D mammography or breast tomosynthesis? So the principle is we still have 2D and 3D images. But the thing is the X-ray tube actually are moving around the patient breast. As it moves, it will take a few, not to say few, they'll take a series of images of the breast at different angles. So as the X-ray tube swipes through an arc, it acquires low dose projection that is around 4 to 10 seconds. So after the images or the exposure has been done, the mathematical reconstruction will be done and the images will be generated at 1 mm slice thickness. So usually it is said that the 3D mammography or the breast tomosynthesis actually exposing the patient 2 times the dose of the 2D mammogram. But the dose are still not significant enough to cause another risk of from the exposure to the radiation. Okay, this is an example of a machine. This is how the X-ray tube is moving. So we put the patient breast onto the imaging plate here. So when we switch on the exposure button, so the X-ray tube will move in an arc. So the movement of X-ray tube is actually based on the angulation that is already predetermined by the manufacturer. So after we have exposed the patient, we will get a series of tomosynthesis image which is in stacks. So usually we get up to 50 images, 50 images of 1 mm thickness slice. All right. So this is another comparison where you have the conventional X-ray, 2D mammography. Let's say you have two lesions, which is sitting like this, quite parallel to each other. So using the 2D mammography, after we have exposed the patient, we get the image. So what we see is just one lesion, which is quite big here. We can only see one lesion because of the overlapping tissue. It's like you have one obese guy standing in front of a thin guy. So you can only see one obese guy, right? So let's say you do 3D mammography using a small angle, which is around 15-degree arc. This is 15 at 7.5 plus 7.5, that is 15-degree arcs. So you still have two lesions. So what you can see is the lesion is separated, but not really separated from each other. So what you see is a big lesion here, but you don't know that there is two lesions. So let's say we do a 3D mammography using a bigger arc of machines. So bigger arcs, this is 50-degree arcs. So two lesions can be seen as two separated lesions. Okay. All right. So let's see a machine demo. This is by Siemens. Okay. The Siemens mission is using 50-degree arc, okay, white thermosynthesis. Okay, 1 second. Okay, let's say we do just a 2D demo, one cranial powder projection of breast. So the X-ray tube is directly perpendicular to the patient breast. So what happens is you can only see one lesion here. So in a bigger arc breast thermosynthesis machine, as the X-ray tube swipes, so you can see two lesions actually in the patient breast. So what happens is you get multiple images and you can localize the lesion and you can see the size, you can evaluate the size of the lesions. Okay, let's go back.
Okay, thank you to Miss Nadia on her great sharing on the 3D mammogram
Not
in
yet.
the field of... Oh, sorry.
Is it 15 minutes?
Okay,
Okay,
thank
I'm
you
going
for
to
the...
It's okay, no worries. Okay,
Okay.
this is the comparison of images. This is the 2D image of 2D mammogram. You can see an enhancement here where there is a lesion, but we don't know how big is the lesion. We don't know what is the location of the lesion. So let's say we do a 3D mammogram. So 3D mammograms means you can get up to 50 slices of the breast images. So you can see the lesion is here at the 14th slice. So 18 slice, it is still there. 22 slice, you can still see the lesion. 26 slice, the lesion is still there. And at the 30th slice, the lesions are also still there. So that means the radiologist can already evaluate the size of the lesion based on the 1 mm slice thickness of the mammogram images. Okay, so what are the benefits of digital breast thermosynthesis or 3D mammogram? So the first benefit is, of course, higher diagnostic accuracy, better detection rate. Better detection means better treatment. And then superior lesion visualization, as what I show you just now. As the tube moves across the patient's breast, we can actually separate the two lesions. Okay, for the patient who has dense breast tissue, so actually they have more glandular structures if we compare to fat. So what happens is in mammogram, the fat will appear gray and the glandular tissue will appear white. So the cancerous tissue is also appearing white in the x-rays. So that's why for the women who's having dense breast, it is very difficult to visualize and to detect the cancer. Okay. Alright, so for the women out there, what you can do is now, if you are 40 years old, you can go and set your appointment to do 3D mammography. So take care of your body is the only place that you have to live. And Happy New Year, everyone. Stay safe. Thank you. Log on to mahsa.edu.my for more information. Bye.
Okay, sorry for the interruption, everyone, and thank you to Miss Nadia on her sharing on the 3D mammography. I believe our audience has learned a lot today from all three presentations by our expert panel. Now we will go into the Q&A session. Okay. We have the first question from Rajan Sundra on any suggestion on how the community can help solve Addis mosquito breeding within their residences. I think this one is directed to Dr. Chia. Maybe Dr. Chia can answer.
Thank you, Miss Muni Amira. I think it is very simple. All right, everyone do their part. What are the things that can be done by the community? Will be just screen the house. Like for example, Once a week, we spend at least 10 minutes to look for any stagnant water, any pots, all right, or any container that with water in it, just remove it. All right, anything that can hold water, just remove it. That is good enough to reduce the dengue cases we have in the country. All right, and a lot of death cases just now we have mentioned is due to the transmission of this disease. And one of the best way is to make sure our environment is clean. And especially now we are in the rainy season, all right, we have to take extra caution with that. Yeah. Thank you, Miss Muniamira.
Okay, thank you, Dr. Chia. And we have another question directed to Dr. Chia as well. This one is from Tengku Nilam Tengku Ibrahim. In your opinion, which is the most effective way to prevent dengue control?
Okay. All right. I think the same things that I have mentioned just now. The most effective way is to take care of the environment. All right. Make sure there is no vector breeding. All right. Take care of the environmental sanitation and so on, so that no vector breeding, especially near our residentials and our workplace. All right, whatever that can hold water should be removed. So that is the best way, and everyone has to be responsible and making sure no vector breeding around us. By doing so, I believe the number of cases will be going down and hotspot will be reduced. Yeah. Thank you.
Okay, thank you, Dr. Chia. Next, we have a question. I think this one directed to Miss Nadia. Raja Fatiha asked a question on, do we have to do both 2D and 3D mammography if we would like to identify any breast cancer?
Yes, so Miss, the one who is asking. So actually, when we do the 3D mammogram, actually both 2D and 3D images will be produced only with a single compression.
Okay, that's a very clear-cut answer. Thank you, Ms. Nadia. And Raja Fatiha also asked another question on what about the duration of the procedure? Is it longer for the 3D mammography?
A few minutes longer, not to worry.
So is the procedure only take a very short time?
Yes.
Okay. Okay. And Mrs. Sim, don't worry. We have a question from you from Azika Kamal. She said that, hi, Mr. Sim. Besides aiding the disabled to move, is there any other additional improvement the hall can provide?
Okay, so thank you for the question. Yes, actually. So if we look into the improvement that HAL can provide. The first thing that when when disabled is starting to move, the first improvement is actually definitely from the psychological side. Okay, so imagine you are a healthy walking person and suddenly one day you just can't move anymore. So a lot of negative impact will be there on your psychological aspect. So helping them being able to move again, it actually cheers them out a lot, and helps them to live their life better, be more positive on things. Okay, so with psychological side apart, okay, let's look at physical. In physical wise, the moment they put on the machine, they put on the hull, they start to move, they start to walk. What happens is the involvement of the muscles are there, the nerve, the motor control, motor recruitment are there. So it actually helps to strengthen the muscles, to improve, to stimulate the affected part of the brain, the region, to able to emit the signals to help them to move around. Okay, besides that, that also helps to, improve the skin sensation as they uses the device, and it helps to reduce the neuropathic pain, because as the patients start to learn new movements, then slowly those pain will actually subside. And the best thing is, eventually there's no need for them to use medical aids, because it looks more cooler wearing a HAL than using a tongkat, the walking frame or stick to walk around. Yeah, so I think that are some of the improvements that you can see.
Okay, thank you, Mr. Sim. I have another question. This one is more toward the personal question. Wherever you give the hall to people, usually how long it takes for them to adapt? Do they need some practice to adapt?
Actually, not really. It depends on the condition of the patient is having, or the wearer is having. If per se you are putting it on a healthy individual, okay, a normal being. So what happens is, you can, because your movement is, like I mentioned just now, the 3 types of control. So based on the individual itself, the how will decide, or the settings will be done to determine. So if per se I'm a normal human being, I mean, I don't have any injuries or what, I'm using the HAL to help in like lifting or anything. So the voluntary control will be in. So it will just be like I'm doing my normal day activity. It's just that I might do it in a stronger way and a safer way, where there's an exoskeletal supporting me, providing me the extra strength. If per se, if is for those with injuries, per se, spinal cord injuries, if for all their injuries are for some time already, a few months or even years, that cases, yes, maybe they might need some time to adapt to, because their body sort of like, have forgotten what the action is really, I mean, how to do those action. Yeah, so it varies depending on cases that you're applying on. Okay.
Okay, thank you so much, Mr. Sim, for the explanation. Unfortunately, we at the end of our today's session. For the audience, do not forget to complete the survey form to receive your e-certificate. You may see the link in the comment box. Thank you everyone for staying with us until the end. I hope to see you guys again in the next activity organized by Faculty of Health Sciences, MAHSA University. Again, thank you, stay safe and take care.
Thank you.
Bye.